Hi, everyone. Welcome to part 2 of 4 of the MS Path to Care webinar series about keeping your world full and active. It's all about managing symptoms. Hopefully, you were able to view part 1 with Roz called. If not, I would encourage you to go back and view that video. I am Mandy Rohrig. I am a physical therapist and programs consultant coach with Can Do Multiple Sclerosis. The learning objectives for part 2 are as follows. We hope that people with MS and support partners will recognize the impact of symptoms and disease progression on emotional wellness, roles, activities, and relationships. Learn how to manage those changes at work, understand the impact of disease-related changes on family members, and then here's some conversation starters to begin problem solving with those important people in your life. So here is your world with MS, your world with your work world, your world with your community, and those important relationships. MS has a way of kind of pushing out some of those important aspects of our lives. And eventually, sometimes MS can feel like it is just making your world progressively smaller and taking over. Rather than this feeling happening, what can we do specifically in the workspace to make your world feel as large and as full and as active as possible? Let's talk about some strategies. Before we talk about those strategies, however, let's talk about the impact that symptoms can have on your work world. It can have an impact on getting to work. Perhaps driving to work is really fatiguing. Maybe you get dizzy or tired when you do too much driving. Getting to work can have an impact on your productivity on the job. So what else? Maybe meeting those deadlines. Maybe it's harder to multitask because of cognitive challenges. Maybe it's harder to perform those physical tasks in the workspace because of fatigue or MS-related weakness or spasticity or other physical symptoms that you might have. Maybe it's maneuvering around the workplace. Perhaps the distance from your parking place to your desk, to the break room, to your boss's office, and that constant maneuvering around the workplace has an impact on your work performance. Physical, cognitive, and emotional stamina over the work week. So it's not uncommon for people living with MS to feel physically and cognitively exhausted after a workday, but often that kind of compounds and builds day after day. So maybe Monday you go to bed and you feel fairly rested, but by Thursday, that night of rest just isn't doing the trick anymore. So that exhaustion has a tendency to build over the course of the work week. Managing bowel and bladder symptoms and other invisible symptoms such as pain or vision issues can have a tremendous impact on your work performance and in your ability to participate in work. You may be constantly getting up and down to go to the bathroom over the course of the workday. That can be exhausting and not to mention very distracting from a concentration standpoint. And lastly, but certainly not least, is communicating with coworkers. And this can be tricky. It's that balance between letting who needs to know and who should know, but also keeping those nosy Nellies not knowing what they don't need to know what they don't need to know. So who to communicate what with and when can be a huge challenge with respect to those symptoms that impact work. So what are some possible approaches to manage some of these challenges that you may have related to symptoms in the workplace? First and foremost, we like to remind you all to request a screening for depression or cognitive issues if you feel that that's an issue, because mood issues and cognitive issues can impact all aspects of your work ability. It can slow your thinking, and if you're struggling with depression or mood issues, that can impact your motivation to participate in work responsibilities. So, certainly get that screening if you feel that that's something that might be a barrier. Use your healthcare team. I can't encourage this enough. If you feel like you're struggling with any aspect of your work, whether it's prioritizing work responsibilities, organizing your day, and trying to manage fatigue, talk with your healthcare team, talk with your nurse, your rehab folks, physical therapist, occupational therapist, your mental health team can help you identify where any challenges lie related to mood and cognition. That neuropsychologist can be incredibly helpful because they can take you through a series of tests that can help you identify where your cognitive strengths are and where there may be some challenges and deficits. And then you can go back to those rehab professionals and your mental health professionals, specifically a speech language pathologist or a psychologist. You can go back to those folks and say, hey, these are my strengths. Can we really focus in on these strengths and use those strengths to develop strategies to overcome and manage the areas that maybe need a little bit more improvement? Very, very helpful. And lastly, that professional listed there, the assisted technology professional, that is a person who is typically a rehab professional, but not always. But there's someone who has additional training in some of the tools and gadgets that are out there that can help make your work life easier. So they may have the initials ATP after their name. ATP are those assistive technology professionals. When we talk about requesting accommodations from your employer, that is a really helpful approach when you're trying to stay employed and, and keep working as much and as often as you can. Requesting accommodations, we encourage you to do that when you feel comfortable. And if you're not sure if you should request an accommodation, talk with your healthcare team, but you can also talk to the folks with the National MS Society. They can be really helpful with um, strategizing what accommodations and how to talk to your employer. That number at the National MS Society is 1-800 FIGHT MS. So reach out to them. But some of those accommodations can include something as simple as a slight schedule change that gives you a break middle of the day, or maybe moving your office space to a different area, or getting a more comfortable chair, maybe changing your parking spot. Maybe it's working from home a couple of days a week, but being open to different options that can help you keep working effectively is a win-win for not only you, but also for your employer, because you will be able to continue to do your job effectively. There is often a place for seeking out additional help beyond just what you and your employer can brainstorm together, and that is an organization called vocational rehabilitation. Vocational rehabilitation, it's often called different things in different states, but it's a state run organization that with the sole purpose of helping people to stay employed or find alternative employment that's suitable to their abilities. So they can come in and they can help make recommendations on accommodations as well as help finance accommodations. So I have had patients who needed some adaptations to the restroom space. Vocational rehab was able to come in and do that. I've heard of clients who've been able to get vehicle modifications financed in order to be able to go back and forth to work to keep them working at their job. So, vocational rehabilitation can be a really helpful resource to consider if you need some additional help. And lastly, but certainly not least, it's important to think about planning for that unpredictable future when symptoms are starting to interfere with your work life. And this again can be vocationally exploring different occupations and also the implications that that can have on your financial health. And again, the National MS Society has a number of really helpful resources and people who are willing to provide some specific guidance on vocational and financial planning. And these are just a few examples of some different accommodations that you could have at your workspace. So, The gentleman on the left has larger text on his screen because he has some vision impairments. The middle screen is a standing desk, which can be kind of nice for someone who perhaps has some spasticity, and sometimes standing up can dampen that spasticity. So consider the modifications that you can make to your workstation that can minimize fatigue but also keep you productive. And then a grab bar. I included that because it's important to remember that accommodations can be in the restroom also. They don't have to be just to your workstation. Accommodations can be restroom, break room, any other spaces that are shared in your work area. So sometimes the hardest part about thinking about how to make your world larger, your work world in particular, is starting the conversation. So here are some examples to start the conversation. Perhaps with your neurologist, you might suggest, I'm not as productive at work as I used to be. I would like to be referred for a cognitive evaluation by one of those mental health professionals or that neuropsychologist like we spoke about. Maybe with a rehab professional, you could say something to the effect, could you recommend some tools and strategies to help me manage my fatigue at work? With a vocational rehab counselor or someone who specializes in work counseling, I may need to change my work because of MS. Could you help me figure out what some other options might be? And then with your employer, maybe you could start the conversation with him or her by saying, I would like to discuss a couple of simple accommodations that would help me to be a more productive employee. And I would just like to add, usually when you start those conversations with employers, they want to help find an effective strategy, again, that helps you to be successful, but also helps the organization or the business to be successful. So accommodations are often a win-win for everyone. So who can help? If you were able to watch the first of this video series, you've seen this infographic before, but this is just a reminder that you and your support team or your family are at the center of this graphic because you are the one leading the charge. You're the one leading the decision making. But you have all of these people and professionals surrounding you to help you make the decisions to most optimally manage your MS symptoms in your workspace. So most relevant, if you feel like your work world is shrinking a little bit and you want to make it larger, would be to talk with your blue circle, so your medical team, your MS nurse, neurologist, your nurse practitioner, but then also seek out conversations with those rehab professionals, the physical therapist, occupational therapist, speech language pathologist, and even that psychologist and mental health professionals can be very helpful related to cognitive issues and challenges as well. So the hope is that if you talk to any one of these professionals about a challenge that you have, that you might be guided to some member on the team who can most optimally help you. So hopefully we've gotten you thinking a little bit during this video about how to make your world larger by using some of these strategies and make MS a little bit smaller and enjoy your workspace and your work life to its fullest. And again, remember that emotional and physical wellness, all the things that we've been talking about, can help your world stay as large as it can possibly be.